Hello, good afternoon or late morning. Welcome, and thank you for joining us. We will be getting started in just a few minutes. Hello, thank you all for joining us. I know we'll give a couple more minutes for people to call in. Hello, and thank you for joining us. We will be starting in 2 minutes. All right, I think we can get started now. I know more people are still trickling in, but I want to start by welcoming everybody to the Lunch and Learn today. I hope it's a happy lunch hour for you wherever you are. My name is Jessica Hoffler. I'm the program director from Cambia Grove, and we are a healthcare innovation hub working to advance healthcare transformation. One of our programs is this Lunch and Learn, which we partner with EcoHealth Ventures on every month. They help us identify what startups and other change makers need to focus on as they mature throughout the year. So this is a special Lunch and Learn. It doesn't follow the traditional annual curriculum, but we've been highly disrupted this year. In just the last few months, we have experienced unprecedented disruption from the COVID-19 pandemic and the current social crisis, which have both exposed flaws in our systems. Today's Lunch and Learn will be addressing where startups and other change makers can drive lasting transformation as we navigate an uncertain phase for healthcare in the U.S. with guests Matt Holman from Canberra Collective and Greg Shibata from EcoHealth Ventures. We have about 45 minutes here, and I'll be taking questions from the audience throughout the discussion, so please post them as they come up to you. How to post the questions is there's a little control panel to the right side of your screen, generally, and there's a little questions area. So please type those in there. and I will be asking Matt and Greg your questions throughout our time. So I'd like to thank our presenting partner, Echo Health Ventures. And now let's take some time to meet Greg and Matt. Greg, let's start with you.
Great. Thanks, Jessica. So for the folks that don't know, Echo Health Ventures is a strategic healthcare investment firm. We were launched in 2016 with two parent LPs, Cambia Health Solutions and Blue Cross Blue Shield of North Carolina. Looks like the slideware is not coming through, or at least I'm not seeing it, so I'm just going to riff a little bit. We're building a portfolio these last 3 years of technology and service companies that, and this is what's really important, align and accelerate our parents' vision to transform healthcare. Now, both North Carolina and Cambia have kind of, in many ways, similar visions for transformation. They're going to go about it maybe in a little bit different way. But what we do is we invest in companies that we feel help accelerate what our parents are trying to do. So as you can see here on the slide, we've got about 25, 26 portfolio companies today. Now, my role in Echo is a little bit unique. As an investment firm, you would think that there is a team that's, finance and investment banker background, and we do have that. We have a real strong team, and if you've attended any of these sessions before, you've probably met several of them. But Echo also has another smaller team that I sit on, and what we do is support the collaboration between our portfolio companies and our parent stakeholders. We bring market insights to where we're seeing innovation out in the startup community, bring those in, bring them to our parents as well. Now, when I say supporting collaboration between our parents and our portfolio, is a very broad definition of that. It could be having a conversation between a key business lead and a portfolio company just to learn from each other about a space. It could lead to proof of concepts or some sort of pilot commercial agreement, all the way up to an enterprise partnership. Again, I work to facilitate all kinds of those collaborative touch points between our portfolio companies and our parents. That's a little bit about me and what I do at Echo, working between both of those groups. Just a little bit about kind of my perspective on the environment that we're in right now. And some of these things you might have already caught in the news or whatever is, but what we've seen is health systems, employers, health plans, they're all really hunkering down. They're focusing obviously on how to address, and build their COVID strategy. How do they serve patients, serve their employees? And I think it's going to be really important for entrepreneurs out there to make sure that their solution aligns with the problems that these at least three big stakeholders are facing. It's not, and we were talking about this earlier, it's not having a solution and finding a problem. You got to know what your problem is, and most importantly, as you're trying to build a business, who are you trying to partner with, and is it the problem that they're going to pay for? Like, I'm going to be the realist in all of this, and always want to look at follow the reimbursement, follow the value proposition. I just saw, and I pulled some stats up, just the impacts that COVID is having on the healthcare industry. The American Medical Group Association did a survey of their health systems. 55% had less than 6 months cash on hand. 80% have furloughed employees. That's the environment that medical groups are facing right now. Hospitals have lost, anywhere between 150 to 200 billion in revenue. Health plans, as they're actually doing fairly well right now, they're trying to estimate and understand the costs of COVID long term. And I just saw this stat this morning, and it's from American Health Insurance Plans. They're estimating the cost of COVID anywhere between 56 to 556 billion dollars. The fact that it's a $500 billion swing is scary, and that's scaring insurers as well. So, and then on the employer side, what are going to be the impacts of the unemployed on ACA and Medicaid? Those employers that do ramp back up, what are they going to be offering? How are they going to help their employee stay healthy? Again, as you're building, your companies and your solutions, I think about who is your channel partner and what are the problems or what's the environment they're facing, and is the problem you're solving going to fall within that priority stack? Just really understand that. That's kind of what I would open up with.
Thanks, Greg. Yeah, a lot of uncertainty there. Matt, would you like to introduce yourself?
Yes, and thanks again for having me. So I'm Matt Holman. I'm a partner at Camber Collective. Camber is a boutique strategy consultancy. We're based here in Seattle. We also have offices in San Francisco and Paris. And we really focus on 3 different areas. And so one is customer insights and behavior change, which is about understanding the needs and issues that inform strategy and based on data and conversations. The second is strategic planning and resource allocation. And so how to make sound decisions and craft flexible and adaptable strategies, which, given the numbers that Greg just spoke to now more than ever, and just in the midst of mind-boggling numbers, how to chart a course and continue to navigate uncertainty. And then the third is building coalitions for impact. And so we try to find force multipliers to drive impact, and oftentimes with common and uncommon allies. And so understanding to drive real transformation often takes a village. And so how do you put together the right coalitions around a common theory of change or thesis, to make the sum greater than all its parts? Generally focused across 5 sectors. US healthcare is one of them. We also do a lot of work in global health, climate and environment, shared prosperity, and also democracy and governance. And if we move to the next slide, our clients are a pretty interesting and diverse mix. So we serve across a variety of public and private, for-profit, nonprofit, clients, and even from very big to very small. And so it's one of the advantages of being kind of a small, scrappy firm as we get to do, work on a broad set of strategic challenges with a pretty broad set of clients. My own perspective is informed for about 18 years in healthcare now, most of it in consulting, and have gone on a journey through the healthcare system. And so I started out in revenue cycle consulting, understanding the nitty-gritty incentives at play that really drive our current model in a fee-for-service world. Moved from there to health plan strategy, and so learning about the incentives that drive the health systems and their associated revenue cycle apparatus are designed, and have found myself now in social impact. And when I think about social impact consulting, it's not about philanthropy per se. It's about driving positive change. And not to share, I guess, the secret sauce of how I approach every strategy project, but a lot of my own career progression has been informed by the curb cut principle. And so that's sort of the idea that if you make curb cuts on a sidewalk to help the disabled in a wheelchair, it has this effect of people walking within a neighborhood of all ability levels. And that's very true within healthcare transformation. And it is, if you actually understand the needs of the most vulnerable and you seek to solve them, that tends to positively impact everyone else. And so therefore it tends to be the most high impact incision point for strategy. And I think in this moment where so many of those vulnerabilities have been starkly exposed for us, I think that's what makes me hopeful, is that we have this incredible opportunity to craft strategies that really that transform the status quo. And I completely agree with Greg on the idea that the smart money is on entrepreneurs that that balance that focus on needs and issues. And I certainly am a bit more of an idealist to Greg's realist, but I think if you do focus on those needs and issues at an individual and humanistic level, in understanding of the incentive systems at play, while pushing on making change for those systems, that's going to be the most powerful and successful form of innovation. And you know, and at the end of the day, digital health is a means to an end. And I think you know, we've all seen a lot of tech and products that have gone in search of a problem, and this is an opportunity to really take a step back and study the problem, and then go build solutions. So I'll pause there, but I'm really excited for this conversation, particularly in this this particular moment.
Jessica, I would be remiss if I didn't jump in. Matt, didn't you have another little short stop somewhere in between your consulting journey, making a social impact?
I may have had a short stop with you know, a sage colleague, Greg Shibata. So I did spend 2 years at Echo Health Ventures as well, where I learned to be a bit of a realist. I tempered my
yeah.
so slightly.
Well, thanks, Matt. And I'm glad that we do have that balance of idealism and realism here in this conversation. So we'll get started. As we all mentioned, events in 2020 have put a lot of pressure on communities all over the globe, dramatically exposing issues and needs. So here in the US, what are the health-related issues that have been exposed? Greg, let's start with you.
You know, I'm going to follow on with those horrible and scary stats. What I would say is that first come to mind, and Matt, jump in at any time. One is just the fee-for-service chassis that our healthcare ecosystem is built on. Hospitals are losing so much revenue because of the elective procedures and the fact that those are high margin, you know, things that they can do. I just see that entire business model just is in jeopardy. We're seeing it with hospitals, specialists, primary care, payers, employers. That, I mean, we've been talking about the, you know, when is fee for service going to shift to fee for value? I'm going to wax a little idealistic and hope that maybe through this experience, we realize that the service model is just not conducive to serving the health of our communities. So I think this COVID has really exposed that. And so, you know, that's one thing I wanted to get out there. The second piece is just behavioral health. That's it's exposed the need. Again, I think there's we've seen over the last 5 to 10 years huge strides with just awareness and acceptance and understanding the importance of, you know, in overall health. There's huge problems just with behavioral health, you know, whether it's access, quality, the experience, and the cost. And I'd be remiss. Dr. Jim Polo, who's a medical director at Regents, we've been working with him pretty closely. He would talk about and actually open my eyes in saying that in the spectrum of health, and you think about primary care and specialty care and acute care and chronic care, behavioral health tends to get one of those silos. And he said, Greg, I can't think of it as a silo in health. Behavioral health spans as a layer across the whole spectrum, right? And it's really important to think about how big behavioral health is and how it plays across all of those traditional healthcare silos that we organize and categorize healthcare in. And so, you know, there's going to be unique solutions and unique problems within each aspect. You know, I don't have a good way of trying to organize that. Again, it's a huge area. I think that's, again, and we can talk about it further, I think it's going to be a big opportunity. But I would say for me, the two biggest things exposed were just the fee-for-service chassis and the need for behavioral health. Matt?
Yeah,
I don't
and
know
it's
if you have
almost hard
anything
to speak to all the things exposed because so much has been exposed. But because it's really a trio of crises that have all come kind of in this confluence. You have a healthcare crisis and COVID-19 that's exposed the fragility of our healthcare delivery system, which was really never built to handle a pandemic like this, and had been kind of delicately built around this mix of primarily fee-for-service incentives, including a certain amount of elective procedures and a certain amount of charity care. And if it all continued to, within a certain margin of error, you could eke out a thin profit margin. And this crisis has exposed just how delicate that balancing act was. I think Greg, we've talked about it as this broken Lego set moment of just like where there have been these moments where it's been clear that it's fragile in the past, but this is the moment where it just all got dropped in the ground at once. There's an economic crisis, continuing to unfold right now, which I think shows the vulnerability of our largely employer-based health benefit system, and the lack, even with the Affordable Care Act, the lack of a safety net that a lot of people have for financing care, should their job go away, and just the instability that causes. And then there's a social crisis that's just beginning to blossom, and with the murders of George Floyd and Ahmaud Arbery, I think represent a symptom of something that is systemic that we failed to fully addressed. And I think there's structural racism embedded in our healthcare system that manifests itself in the health disparities that we have to deal with on a day-to-day basis. And we haven't fixed those foundational moorings. And so instead, it manifests itself in far greater costs in dealing with a crisis like COVID. And so it's almost like this vicious circle, where all of these, unforeseen things have come together at a single moment, and we're like living in this moment of history. It's hard for me even to parse out, the signal from the noise in the current moment.
Yeah, there's a lot to process about everything going on right now. And you both talked about value-based payments, and we understand that one of the foundational elements of healthcare is payments and incentives. And I'm curious if you can elaborate on the impact of the transition from fee-for-service to value-based payments on the startup or changemaker community. What should they be prepared for, and how will those reimbursement models change for them?
How much time do we have?
90 seconds.
Yeah. So we were just having a conversation about this internally, right? There are, every large insurer, large health systems, there's some sort of value-based agreement that's in place. CMS has VBAs, ACO models. They're out there. I think you're going to see a temporary pause on kind of enforcing the evaluation of those quote total cost contracts, just because of what COVID, and it came out of left field, and not understanding the costs and the impacts. But I think that you're going to see the conversation come back and say, and what I'd love to hear and see is that everybody gets that 1 year maybe moratorium. We understand the impacts that everybody's facing, but I'd like to see how this accelerates the changes to get to fee for value, that you're paying for the outcomes and not just paying for more and more procedures, more and more utilization, not paying for things that shouldn't be occurring. But again, I think there's going to be this timeout or break, but I'd like to see, and it'll be really interesting to see how coming out of this, how that fee for value conversation comes back in, because it'll have to, because I think that's going to be one of the ways to really address the new norm that we're going to be facing. It's going to be a new reimbursement model.
Yeah,
And I know
mean,
that's more than 90 seconds. But.
And I would say, since we're over our 90 seconds, I would say I agree that I think the dust has to settle to some extent. I do think that there's going to be an opportunity space, and we'll probably get into this, for an acceleration of that transition to value, in particular risk-taking, in particular risk-bearing kind of primary care-oriented models that, and I say models of care versus just telemedicine. So models of care that deploy a large amount of virtual care to them. And because I think we're in this interim new normal phase, I think that you're going to see virtual based models of care emerge and rapidly become more sophisticated. And I think some of them will be able to position to take risk and actually become big winners in bearing risk within that, fairly efficient modality, in a way that the pieces just hadn't come together before, and so it wasn't particularly feasible. So Greg and I can debate that a little bit.
Well, but let me just add to what you said. I think a stronger virtual care strategy is going to emerge out of this, but it's not the silver bullet. It's not, you're not going to see, it's not like a light switch where it goes all to virtual care. It's just going to be a bigger part of the spectrum. Care is going to be delivered. They're still going to want brick and mortar. Some are going to want to go, kinds of convenient modalities, and some are going to want that hybrid in the middle. So I think it will occupy a bigger slice than it has to date. With some employers about 2 weeks ago, and the tailwinds behind virtual care are huge, because for several weeks, 10 weeks, virtual modalities were the only way that you could get primary care, certain things, because you just didn't have that available. And I think hopefully the data proves out that these new modalities actually delivered quality care as well. I think people were always skeptical, but for in the early parts of COVID, that was the only way to get access to care. And I think that it's shown that it was effective, high quality, engaging. But I don't anticipate a light switch and a huge move over to that. It's just going to occupy a bigger part of the pie.
Great. Well, we're seeing some optimism here, changing a little bit from doom and gloom to some optimism. So where do we see opportunities for entrepreneurs, community-based organizations, and others really trying to drive change? Matt, let's look to you.
Yeah, and I mean, I would start with that point of optimism, which for me, I mean, even though we started with a little bit of doom and gloom, I am incredibly optimistic, just in the sense of the structural, behavioral, and even the matter of time, the temporal aspect of COVID creates the tailwinds for transformation that have not existed in our lifetimes. And I think I hope they don't, these conditions don't exist again. But I mean, and just if you look at the structural changes in terms of the regulatory barriers that have fallen, that I think we have a chance to keep down through the CARES Act and the Section 1135 waiver that HHS issued, that really relaxes a lot of the requirements, specifically around telemedicine, but more broadly around how Medicare recipients can receive care. If you also look at the reimbursement parity that has risen for virtual forms of care, and again, some of that is going to recede, but we're already seeing leadership among a lot of the Blues who've committed to keeping that in place, at least for now. And we've seen behavior change on a par that is incredible. So telemedicine alone, if you look at utilization, we've made more progress on telemedicine utilization in the last 10 weeks than in the last 10 years. Some of that will go away, but that is a huge step, in the right direction. And it's not just telehealth utilization, but if you think about patient engagement as it relates to all of is involved in COVID, around social distancing, around the isolation protocols for those who have been exposed, just around basic hygiene. You know, we don't talk about this in this way often, but we're seeing effectively collective population health engagement in ways and on a par that we haven't, you know, seen really in our lifetimes. And then in terms of time, this may be controversial, but I do think that there's a gift in the sense that we're not going back to normal tomorrow. So the original COVID period you spoke to, Greg, in terms of everybody was forced into telehealth, for instance, or virtual care models. And now we're beginning to go back to normal, but we're not back to real normal until there's a vaccine, and that's 12 to 18 months away. And the risk of seeming cynical, I think fear is an incredibly powerful carrot with regards to continuing to push on some of these unprecedented changes in terms, including patient behavior and the modes of which people are using care. And I think also from an innovator perspective, the fact that this is a global pandemic and we have this incredible sample size of literally every country in the world has experienced this virus and this outbreak in similar ways at the similar times, and we can actually look at every health system in the world and how it responded to this crisis and what worked well and what didn't, and think about how you innovate and scale around some of the best practices. You know, that's a pretty powerful data set to choose from. So that, I mean, I would say that would be my silver lining sort of sense of optimism on a whole. And then I guess if we were to step into the near-term opportunities, I mean, I think that all of those conditions will continue to create opportunities as we move forward. But if I were to start with the most clear and present opportunity that exists for us now, based on some of those points, it's really around seniors for me, because I can't imagine. You know, and I have a father who lives in an assisted living facility who's been effectively on lockdown for the last 10 weeks. And I can't imagine anyone over the age of 65 with underlying health conditions wanting to sit in a primary care clinic waiting room in the next 12 to 18 months. So going back to needs and issues, how do you serve those populations? And, you know, I think that there's, in the near term, but models that persist in the long term, we should think about how do we create models of care for seniors that absolutely minimize the amount of time they spend in inpatient acute settings, for sure, but even outpatient settings. And so we're seeing a lot of uptake in telemedicine today, but how do we think about, on that continuum, Greg, that you spoke to, virtual care, virtual models of care that combine telemedicine in person? So how do you go to, you know, meet them where they are, wherever they might be, for things that don't really lend themselves to pure telemedicine. So people still need to have labs done. They still need to have physical therapy. There's still certain vitals that are difficult to deliver through tech-enabled means, but how do you sort of pair those with them? And there are certainly, you know, emerging companies that are doing some of that right now. In addition to just conversations. So I think there's an epidemic of loneliness and isolation now amongst many seniors, and mental health that has emerged. And so how do you actually provide that? But I think that innovators that actually create more holistic models of care targeting seniors are actually going to see that we can probably deliver care for those populations more efficiently and have a tremendous ROI if we do that well. When you think about the ever-changing needs of the senior population, it's kind of that shift from, like in diabetes, from discrete glucose monitoring to continuous, or even like if you're landing a plane, are you changing course once every minute, or are you actually constantly changing course? The ability to actually engage using some more technology with a much higher frequency with senior populations, I think potentially allows us to provide higher quality and outcomes and avoid a lot of the, you know, acute incidences that occur through accumulation of insults between doctor stays. So I would call that out as, in my mind, number one, both because it's where all the money gets spent, as well as kind of where I think a mix of technology, but probably emerging from individual type point solutions or even platforms to thinking about it from a model of care perspective.
Matt, I'm going to follow your train of thought there around seniors. I'm going to take it a little bit further, which is, yes, there's Medicare fee for service and CMMI and what Medicare is doing. There is a lot of innovation. I also just find it actually really hard to get plugged into that for new entrepreneurs. I would think about locally, and I would look at one of two channels for yourselves. It's either going to be the providers, or it's going to be payers with their Med Advantage products. So really understand who your channel is going to be per payer, and as Matt said, what are the problems they're trying to solve for? It's how are they going to deliver and manage care? How are they going to coordinate care? And again, it's going to be across that spectrum of brick and mortar and hybrid virtual. New businesses that I think are going to have to emerge. As Matt said, there's going to be a big population, and maybe we shouldn't be sending that population back into brick and mortar settings just due to risk. Well, you still need to be delivering, chronic disease management care, basic primary and preventive care, not to mention how you, intercept when there's acute issues. There's a lot of innovation already in that space, and I think that COVID, the opportunity here is accelerating those, scaling those things, because we need to serve those seniors now, and we have to meet those needs in a combination of, in a way that crosses multiple modalities. But again, think about who your channel partner is. Think about the reimbursement incentives that exist with them and how you're helping them solve those problems, right? Not saying to, change the vision if you're an entrepreneur, change the vision of what you're trying to solve for, but be realistic about who you're solving it for and how you could, get that solution out to market to make the impact that you're trying to make with patients and families and with communities.
Yeah, I would say, I think credit to some of the large payers on being more creative on incentives in addition to CMS and CMMI. Obviously with Z codes and you're seeing a lot more coverage of social determinants of health and areas that weren't previously covered. And I do think, credit to them for that, and also onus on them to continue to push the envelope for some of these temporary changes making permanent, and actually also pushing further for some of the flexibility that's necessary to really create new models of care, where we can deliver some of these better outcomes.
Great. So you've both talked about incentives there. Again, that word keeps coming up. And I've heard that employers are some of the most incented stakeholders to have good outcomes and keep costs low. Greg, you mentioned earlier that you talked to a panel of employers or purchasers within the last few weeks. What are you seeing there? Any opportunities?
So when you think about employer-sponsored coverage, and I'm sure every entrepreneur that's out there has that dream of landing that whale, right? That big jumbo employer self-insured client. But that's hard, and it's going to continue to be hard. And I would actually point folks in the direction of what COVID exposed is the huge problem that the small and medium-sized employer is facing, right? You've heard it before. No employer wants to be in the business of healthcare, let alone small-sized businesses. And I think what we've seen out of COVID, people have lost their insurance, or people are struggling with their business ways insured. What are the that entrepreneurs and innovation can help create actually new insurance models? Dare I say, do we see defined contribution really come back into play, where that transfers the risk, away from employers, that they're not managing healthcare? It gives choice to their employees to pick the individual plan that suits them. You see, we've been saying over the last 10, 15 years, increased cost sharing, increased responsibility for employees to navigate. And we've seen a lot of innovation in helping those employees navigate and understand, cost and transparency. I'd love to see more of that in the small, medium-sized employer market. I'd love to see employees. They are the ones that need the most help. Have a big jumbo that's kind of underwriting these tools. We've not yet seen the trickle down as much in that smaller business segment. And I think that's a huge opportunity moving forward for all of us today. Matt, I mean, we can go on and on about employer-sponsored coverage, and I think we lost Jessica, so I will have to self-moderate.
Yeah, no, that's okay. I mean, I generally agree, and I think that obviously employer-sponsored coverage infuriates me sometimes because it is where all digital health entrepreneurs focus, even though it is not necessarily the most vulnerable population, but they serve a lot of vulnerable populations. And I do think in this moment, all employees are traumatized in one way, shape, or form. All employers, or most large employers, are having conversations about diversity, equity, and inclusions. And employers have the broadest latitude in how they construct and deliver their health benefit set. And so there's an incredible opportunity to think about how they integrate behavioral health and how they incorporate some of the DEI lip service that they might be having in a separate circle into how they think about the construction and delivery of their health benefit set. I think that that's something, that is a great opportunity, in the same way that more employers are thinking about social determinants as part of their health benefit set. I also think that just employers are going, in the near term at least, are thinking in a more active, engaged way about uptime of employees, almost like, not to say that employees are cogs in a machine, but this idea of maintenance. So you're already seeing sort of like collective health coming out on integrating contact tracing into sort of the delivery mechanism. And so I think we're in an interesting moment in how employers think about health benefits, just because the risk is so proximate to employer health and employer productivity, and how they manage that as they attempt to safely bring employees back online in a physical way. And so, I think there are a lot of very near-term opportunities that sort of exist within that will probably lend themselves to new paradigms for how we think about health benefits as we move forward.
I want to piggyback on something you said about uptime or productivity. It's one of the things that we know that employers are concerned about, but it's actually one of the hardest ways. And I've seen very few startup companies that, as they're trying to sell into employers, they will talk about how they address costs, medical cost savings, or how they're going to meet quality needs. How we measure productivity, I think, is something, again, we don't have a good way to look at that. But if you're going to sell into employers, you've got to think about the downtime that they have, think about their productivity, and what are the metrics that you could gather with your solution that speaks to it. Again, that's the language that employers speak: cost, productivity, some degree quality, to some degree experience. But let's be honest, it's generally those first two.
Yep. And
now,
I know we're going to run out of time.
Yeah, we are. Well, we only have a minute left, so I'm hoping that you can briefly talk about, you spoke about remote access, and now employers dealing with people working remotely. What about rural opportunities? Do you have a moment just to talk about that?
Yeah, I mean, I think I mentioned sort of the broken Lego set moment, and that is 100. So rural healthcare was, not to say failing, but was under incredible stress before this. We've seen hundreds of rural healthcare hospitals close in the last decade. And I think in COVID, we're already seeing this bow wave of people, now that they can work remote, moving to rural areas that have systems under strain. And I think also, in my mind, rural healthcare was never built to be particularly sustainable in the sense that it was largely a replica of big city hospitals. And so the big blue H in rural communities, is the largest employer in town and tends to perform a lot of the procedures that bigger hospitals do, but at low volume and sometimes lower quality. And I think this is a moment to rethink that model fundamentally. And I think considering the needs of rural communities around stable, emergency care, stabilization, triage, and then, either and then transport in many cases out to centers of excellence. And then also really high quality primary care and population health that does leverage more technology, specifically in areas like specialist consults. And so load balancing specialists across a broader set of rural communities, but ones that are located rurally and understand rural health needs, for instance. I think there's just incredible opportunity there in completely rethinking the rural health operating model. And that could be an entire, I think we could expand for an entire session on that, but that is just a massive, massive opportunity when you look at the losses. This is an existential crisis for every single rural healthcare provider today. And it's a moment where they have to rethink their existing service model and incentive model. And so, from that crisis, I hope that there's sort of that opportunity to re-architect it. And I think that there's a tremendous opportunity for innovators to play a role in that. Greg, what do you think?
I was going to follow up on your point about centers of excellence, right? Was it 8-10 years ago we heard about medical tourism, but it's because employers saw that there was better outcomes, lower cost of care when you did those procedures at a place that does many of those procedures. More recently in the last 4 or 5 years, you've seen large national employers that'll fly an employee from one state, 4 or 5 states away, because they know that they're going to get better outcomes, better cost, if they do that. And so I think that might be a way. Can we use what we've learned and set it in that center of excellence model for rural care? Again, I haven't seen it applied, but I think that there's a huge opportunity. We're seeing a huge uplift in bundles of care in terms of how we pay for specialist procedures and things. And I think as it relates to rural, why can't I just bring a patient from Tillamook County on the Oregon coast into Portland to a facility that does that procedure a lot? They know how to do it, they do it right, as opposed to having it done at some hospital. And I don't mean to beat down on whatever hospitals out in Tillamook, but you get what I'm saying. I think you can apply that center of excellence model, because as you said, Matt, in re-architecting rural health, I don't think the big hospitals in those rural areas need to provide all services for all people. And that might be controversial, but I think that COVID has exposed that, and maybe this is an accelerant to build those new models.
Great. Well, I know we're past time. I'm wondering if you have any final thoughts that you want to leave the audience with today.
I mean, I would say, obviously, we didn't have enough time to cover all the opportunities that we would have wanted to, but I think one space that we didn't cover speaks volumes, which is Medicaid, and I think that should give us all pause. For that is the payer that covers our very most vulnerable, and I think that the reality is we just have so much more work to do to create consistent policy and incentives that de-risk innovation for those populations, that it doesn't rise to the top of the list in terms of where you can see obvious opportunities for digital health players to move toward in big ways. It takes a lot of courage. It's the right thing to do, but it takes a lot of courage in the current environment to innovate primarily for those populations. And so I think that's just for those of us in other stakeholder roles within healthcare who have power to influence policy and incentives, I think that there's a lot of work to be done there.
And, you know, I'll just close with, again, you know, a pitch for behavioral health, but, and Matt, you touched on it with Medicaid, and you mentioned it before earlier. I've got a particular interest in social determinants of health. So how do you, where will that begin to, can COVID be another tailwind to drive a larger view of health on the individual? Not just their health care, but their actual overall health. And when you start thinking that way, you gotta start thinking about those other drivers of health. We're seeing some of that in the commercial space. You obviously see that in the Medicaid space, as you said. I'd love to see more of that come into the commercial side of the equation, though. So that's where I would think some future innovation could be fruitful. Behavioral health, social determinants.
Wow. Okay. Matt, you use the term re-architecting. I really like that. It sounds like everyone is re-architecting their systems right now, the hospitals, providers, the payers, the employers, small and large, and then the entrepreneurs and other folks out there trying to engage. Everyone's re-architecting and aligning incentives, finding those who's paying for what and why. Thank you so much for talking today. That was really fascinating. I know we went over by 6 minutes, could have gone by 6 hours. So thank you. For everybody who joined, we recorded this session and we'll be sending a link out within a day or so with a recap. So thanks for joining us. And please stay tuned to our calendar. We'll continue our virtual events. And we look forward to seeing you and keeping these conversations going. Bye-bye.
Thanks so much. Have a great afternoon.
Thanks, Jessica.